So a lot going on. In addition to this, Vermont has not only passed through their legislature and signed by their governor, but now, and in fact, the governor, Peter Shumlin, ran on this platform of universal health care for the state of Vermont, a statewide single-payer health care system. But now they've put together a committee to actually put it into place. The other thing that they're waiting for, this committee will actually organize how it's going to work, a legislative committee. The other thing that they're waiting for is that this won't be legal for a state to do this until, I believe, 2017, maybe 2014. I think it's 2017 because 2014 was when Obamacare finally kicks in, and I think 2017 is when the waivers are easily given. But Congress can give a waiver earlier. I wouldn't count on it for this session of Congress, but maybe the next one. But perhaps Carrie Lukas knows a little more about this than I do, the managing director at the Independent Women's Forum, Carrie Lukas, IWF.org. Hey, Carrie, welcome back.
Hey, thanks so much for having me on, Tom.
Why? I'm assuming that you're opposed to Vermont having a single-payer healthcare system in the state. Am I correct in my assumption?
Well, I think it was interesting listening to your description of what's going on in Vermont, because I wonder how people in Vermont feel right now. You've got a small cadre of policymakers or this elite group that's going to sit down and decide how the healthcare system is going to work for the entire state of Vermont. So they're going to be deciding what insurance can and cannot have, what it's going to cost, how it's going to be paid for. I really just think it's a tremendous loss of liberty, and it just seems like a power grab. I mean, I wouldn't be comfortable with any elected people, Republicans or Democrats, making such sweeping decisions for my health care and my family. And it just seems I would hope that anybody who loves freedom would be a little bit worried about giving so much power to this handful of probably not even elected. This is probably just a group of bureaucrats who are in high places and have been able to influence and become named by these powerful politicians.
No, it's actually the House Health Care Committee. But okay. the voters of Vermont did speak on this, though.
They're going to be milling around there, making their views known, though.
Yeah, no, I get your point. I lived in Vermont for 10 years, so I have some familiarity with the politics in that state. And again, let's keep in mind, there's only 600,000 people in the state. It's like I think Bernie Sanders has probably shaken everybody in the state's hand at least 3 times. I mean, it's that small, right? But the Peter Shumlin, who was a state senator for years and years. I mean, I knew him when he was in the Senate when I lived in Montpelier, the state capital. I didn't know him well, but I knew who he was. He ran on, this was almost a single issue campaign that he ran on, and he was running against, I believe, Brian Doobie, the lieutenant governor, who had been lieutenant governor for a number of years. Jim Douglas, the governor, won while I was still living in Vermont, and with about a 40% piece of the vote, because there were 3 parties involved. There was a progressive party in there too. But basically, you had a Republican governor and lieutenant governor, and the lieutenant governor was this was a hard-fought campaign. And Peter Shumlin's pretty much single issue was, we're going to have single-payer health care in this state. The legislature passed it. It passed the House. It passed the Senate by fairly large margins, actually. And the governor signed it. So, working out the details of exactly how the bureaucracy is going to work, the framework has been put into place. I don't think the people of Vermont are feeling like they're not being represented. I think, if anything, they would say that this is exactly what they want.
I wonder, Tom, though, as you say that, because I bet a lot of people say, "Oh, yes, health care for everyone," and like this idea of you being able to cut through what we all know is, our healthcare system is far from perfect and has too much red tape and can be very complicated and expensive. And so a lot of people are going to say, "Sure, yeah, we want to chuck it," but then when it starts coming down to the details, that's what really ends up making a mess, and what I think a lot of people are going to be uncomfortable with. We've seen how this works in other states and indeed in other countries as they start deciding, well, what does it mean to have single-payer insurance? What exactly are the taxpayers going to say they're going to pay for everybody? You have the big ticket, are they going to provide abortions? Is that going to be covered, which is obviously one of the hottest social topics you have. But
I frankly doubt it, actually, but who knows in Vermont? But that's up to the people, isn't it?
What about IVF?
Abortions are perfectly legal. But well, actually, let's not make this a debate about abortion. I mean, that's really a side issue. The fact of the matter is, though, Carrie, that, I mean, have you ever seen the pictures of Stephen J. Hemsley's mansions around the United States, around the world? Or Angela Braley? I mean, Stephen J. Hemsley last year was the most highly paid CEO in America with over $100 million. And he's the head of the United Healthcare, the largest of the health insurance banksters. And the people of Vermont are simply saying, we're sick and tired of skimming, $100 million bucks a year off the top to give to this guy. There's over 100 executives at United Healthcare who make over $1 million a year.
Okay, well, you know what?
That's nuts.
We can all complain about how much people are paid. Do you know how much a lot of these lobbyists make? And do you know what these lobbyists are going to be going to? What we've seen happen.
I think lobbying should be illegal. I think it's called bribery.
They're going to come into a place like New Hampshire and say, we want to have, everybody needs to have, this type of acupuncture treatment needs to be covered. This type of expensive, plastic surgery needs to be covered. And there's going to be a whole lot of people jockeying for what becomes mandatory. We've seen this happen a lot, and the bills are going to start going up. So to say that, nobody likes the influence of money, putting it in charge of government is certainly not, as you talk about all the time. When government officials have power, that's very corrupting, and there's going to be a lot of money poured in from all over the place trying to get a piece of it and forcing taxpayers. So,
You mean by healthcare providers? I would expect that they would speak out in public forums.
But they'll also, they're going to be lobbying to make sure that they're, that they're.
I don't think the acupuncture lobbyist has that much money in Vermont, Carrie.
Okay, well, who knows? I mean, we've seen this happen in Massachusetts. You start out with saying only these 5 things or these super core preventative services need to be covered.
But Massachusetts, Romney Care is quite popular in Massachusetts. Well, I mean,
Tom, we have very different opinions on that.
I'm talking about just the opinion polls. It's like over 70 or 80%, isn't it?
Well, it'll be interesting to see how that plays out over time, because there's a lot of doctors are leaving, a lot of hospitals are consolidating, and insurance providers don't want to play in Massachusetts as it becomes more and more expensive, and as their profits are
less and less profitable,
operating at a loss.
Yeah, so, well, if in Vermont there won't be any profit for them. So, for the health insurance companies.
To see what that's going to do to the healthcare system, because I think most Americans understand that profit isn't evil. That's a lot of reasons why we have the most
Well, I think it is evil, though, when it comes to the commons. But I think you're right. We are going to see what happens. This is what Saskatchewan did, as you'll recall, and the entire country of Canada jumped on the bandwagon. I think it's going to be a fascinating experiment. And, Carrie, thank you for your thoughts and insights.
Great, thank you.
Carrie Lukas, IWF.org is the website.